Caring for the Native American Patient by Rachel Ferris. Defining the American Indian. To date, there is no legal definition of an Indian. However, U.S. courts have traditionally used this two-part description. Terms used to describe a person as an Indian include Native American, American Indian, North American Native, and Indigenous person. Most Native American elders prefer to identify with the term American Indian. Indian country is a term used to describe reservation lands. However, it is also considered to be a state of mind. Many people think that Native Americans primarily occupy rural and reservation areas. Yet as of 1990, 62% of those who identified themselves as Indians resided in suburban areas. And almost one-half of the Indian population over the age of 60 reside in Oklahoma, California, Arizona, New Mexico, and North Carolina. Stereotypes. The stereotypes you see are false. Many reservations suffer from environmental hazards, and the people that reside there often suffer from extreme poverty, going without such conveniences as refrigeration, fresh water, home insulation, and telephone and internet services. Today's younger generations do not have strong ties with their heritage, and many modern families do not practice Native American traditions. Contrary to popular belief, the Indian population is growing every year. Sports and school mascots are considered very offensive to Native American people. And as previously stated, more than half of the United States Indian population reside in suburban areas today. Discrimination. Native Americans largely face institutionalized discrimination. For example, the government restricts access to sacred and religious sites, and then they destroy these sites to allow for the construction of highways and cities. The possession of sacred objects is often prohibited, as was the use of religious substances such as peyote until relatively recently. This makes it very difficult for the Indian people to continue and pass on their religious customs. Offensive sports and school mascots are commonplace in the United States. And because reservations are primarily found on marginal lands, there is a high prevalence of environmental hazards there. Indian women are 3.5 times more likely to experience sexual and physical abuse than any other ethnic group. These crimes usually occur on tribal lands and are most often committed by non-Indian males. A lack of law enforcement on tribal lands means that crimes such as these are likely to go unpunished. Some cartoons for thought. Communication. While most Native Americans speak English, it is important to know that there are over 100 spoken indigenous languages, so some patients may need a translator. As a healthcare provider, it is important that you introduce yourself to the patient and his or her family. Try to avoid direct eye contact, especially with elders, as direct eye contact is a sign of disrespect. A light handshake with a few feet of personal space is a good way to meet the patient and their family for the first time. You may address the patient by their first name, however, it is inappropriate to ask if they have an Indian name. Be sure to ask what the patient's traditions are and listen intently to their response. Do not be in a hurry. It is normal for the Native American to use metaphors, stories, and anecdotes to convey a deeper meaning during conversations. When a patient does such, it is important for you to pay close attention to what the patient is saying and to refrain from asking questions until the patient is finished speaking. Intelligence is measured in one's ability to listen and ask the right questions. Therefore, interrupting a speaker is considered very inappropriate. Polite humor between the healthcare provider and the patient is a great way to build rapport, as humor is a facet within their religious beliefs. When questioning the Native American patient, expect long pauses before they answer you. It is common for the patient to carefully consider their answer before responding. Nodding of the head, pursing of the lips, and pointing at the chin are all ways in which Native American patients show acknowledgement. It is very important to include the patient's family in discussions regarding treatment options and end-of-life procedures such as DNRs. Religious point of view. Native Americans view people as extensions of nature, and as such they seek to maintain harmony with nature and look to it to provide healing. Health and goodness are synonymous to the Native American, but goodness is reliant upon being in harmony with nature. Therefore, their spiritual beliefs, their environment, and the way they practice healthcare are intimately tied to one another. Illness is thought to affect the mind, body, and spirit, and they view illness as an imbalance between the person and nature, perhaps as a result of breaking sacred traditions or participating in something considered to be taboo, and they use a variety of holistic practices to restore harmony. It is normal for a Native American patient to wear a medicine bag, and while it must be removed, try to avoid handling it as much as possible and keep it close by the patient's bedside or in contact with their body if able. Family members may want to bring in sacred items such as soul catchers to hang above the patient's bed, so be courteous and accommodating whenever possible. It is also not uncommon for the Native American patient to request the services of a healer, and if possible, accommodate this request and ensure that adequate privacy is given to the patient while the rituals are being performed. Death is viewed as a natural and acceptable process. The soul, having finished its work here on earth, leaves the body to move on into the next world. It is also believed that when a person has dementia, the soul has already left the body, and the body is simply slow to follow. Photographs, x-rays, and other imagery is said to steal one's soul, and the cutting of hair is an expression of mourning, so ensure that permission is granted first before performing one of these procedures. Always explain treatment procedures and the reasons why they are being performed. And finally, humor is considered an essential part of staying in harmony with nature. It is said that humor reminds oneself about one's own foolishness, so feel comfortable with interjecting modest humor into conversations with the patient. Family orientation. Family is considered to be the core unit of the Native American nation. However, family is not limited to blood relatives alone, but rather it is the smallest subdivision of their tribe. In addition, the Native American family may be matrilineal, and therefore it should not be assumed that the male of a family is the dominant figure. In many cases, the eldest female may hold the decision-making power and authority over the rest of the group. Ensure that the family has privacy with the patient whenever religious rituals are being performed. Communication with the patient's family in regards to diagnoses and treatments is essential. Gender issues. As stated previously, do not assume that the males in the family hold authority. In many cases, the eldest female of the group will be considered the authoritative figure. A woman who is on her moon time, or who is menstruating, is considered to be in an important time of power and deserves respect. In many ways, Native Americans enjoy a great deal of equality between the sexes that may not be found in other cultures, so ensure that you maintain that same attitude of respect. Native Americans are very modest people, therefore try to pair a male patient with a male nurse or doctor and a female patient with a female nurse or doctor. Also try to ensure that the patient's body is not exposed to others whenever possible. Time orientation. The Native American concept of time is directly tied to their holistic belief system. It follows a cyclical rather than clock-oriented schedule. The Native American is unhurried and very much in the moment. Their concept of time has been likened to a still pond where life events occur as ripples. Tasks are accomplished as needed rather than planned well into the future, and this can present problems when attempting to schedule appointments on future dates. To make it an easier process, try to schedule appointments within a general span of time and if possible around the same time as naturally occurring events, such as meal times and even sunsets. Ensure that the patient is aware of the seriousness of the appointment if it is such. but expect that appointments may be missed due to time orientation issues, and thus active follow-ups with the patient may be necessary. Expression of pain. In general, Native Americans are less verbal when expressing pain. Their nonverbal expression of pain is also very subdued. They will rarely request pain medication and may endure pain until the point where they become physically disabled. Communication of pain is generally done through family members who convey the information to the healthcare providers. Pregnancy and birth. Stoicism is highly encouraged during labor and delivery, so do not be alarmed if the patient seems quiet and reserved. Many Native American women will have a female birth attendant present during labor and delivery, and this is usually a family member or a close friend. Be sure to ask the patient about her tradition regarding the newborn's umbilical cord before it is discarded, as it has religious value to some, and they may request to keep it. It is not uncommon for the mother and the newborn to stay indoors for as many as 20 days postpartum, so consider this tradition when scheduling postpartum checkups. End-of-life issues. Death is seen as the natural process of the soul leaving the body once it has completed its earthly task. However, Native Americans do not believe in hastening death by demoralizing a dying patient. Expect the family to be jovial and light around the patient, as this is a means of keeping the patient's spirits high. Do not mistake this for detachment, as it is very common for the same family to shriek and wail when a patient has passed away. Depending on the tribe, a variety of practices occur, such as opening the windows in the room to free the loved one's soul, or orienting the patient's body in a cardinal direction before death. The offering of prayers by the family is also a very common practice. Traditional Native Americans do not encourage life support or autopsies, and amputated limbs are often cremated and kept so that they may be buried with the individual at the time of death. Health-related practices. Traditional Native Americans believe in holistic healing practices in combination with westernized medicine. It is not uncommon for a healer to be requested by the patient to perform healing rituals at the hospital. These rituals may include chants, drumming, blessing of meals, placement of sacred objects within the room, and the burning of incense over a patient. Be sensitive to the needs of the patient and the healer, and refrain from touching, casually admiring, or mocking objects placed in the patient's room. When considering the nutritional needs of a Native American patient, be aware that many may be lactose intolerant and may not eat outside food that has not been blessed by a healer or priest. Consider dairy-free options and try to provide the patient with a selection of traditional foods such as meats, fish, breads, beans, coffee, and tea. Final thoughts. When caring for a Native American patient, be sure to consider environmental factors that may be contributing to their illness or injury. Because of the environmental hazards present on reservations and the poverty faced by many who reside there, waterborne illnesses are among the most frequent causes of hospital stays for Native Americans. High levels of alcohol and drug abuse are also related to the impoverished state of many reservations. High levels of obesity are tied to the lack of refrigeration and clean water available to Native Americans on many reservations. This makes it impossible for the storage of fruits and vegetables and other healthy options. Convenience foods that have long shelf lives are consumed as a result, making the modern diet of many Native Americans a high-fat and high-sugar one. A combination of these factors, in addition to emotional traumas experienced in previous years because of the marginalization of the Native American people, make Indian adults 70% more likely to commit suicide than any other ethnic group. And Indian youths are twice as likely to attempt suicide than peers from any other ethnic group. Treat the Native American patient with cultural and emotional sensitivity. Seek ways to become more educated and more understanding of their cultural practices and beliefs. It is through striving to become culturally competent that we as healthcare providers can deliver the highest quality of service no matter what cultural differences we may encounter. Thank you.